Hello, Dr. Eugene Aiello here. Thank you for watching my next video. This video I want to discuss medications, specifically heart disease. I have a lot of questions from patients who ask me about, do I need to take my cholesterol medication? That's a huge one I get questions about because so many people are coming in pain and muscle cramps, and everybody knows that that is a side effect of these statin medications. Is it even doing anything for the patient? So I want to discuss that. The other one is high blood pressure medications. I have patients that are on 1, 2, 3, sometimes 4 of these medications, and they're afraid to get off of them because their doctors just keep insisting if they don't take them, they're going to have heart disease. So I want to talk first, most prescribed medications in the United States. Number 1 is Lipitor, which is a cholesterol medication to purportedly lower your cholesterol to prevent heart disease. That makes up 7.5% of all the prescriptions. The next one being amoxicillin, an antibiotic, making up 6.2% of the prescriptions. Wonderful that we invented that to save so many lives, because that decreased prior to the invention of antibiotics, the discovery of antibiotics. Pulmonary diseases, influenzas, different bacterial infections of the lungs were the primary cause of death back then, well over heart disease and cancer. So the discovery of antibiotics, that really changed everything in our life expectancy. But during that same time frame, heart disease and cancers have gone way up. So we're going to talk a little bit about that. Number 3, lisinopril, making up 6.1% of the prescribed medications, a blood pressure medication to lower blood pressure. Thyroid, Synthroid, I believe is what it was, 6%. I was quite amazed when I saw that. Why the heck we have so many people with thyroid problems? There's obviously something going on with autoimmunity. Something's causing our body to attack our thyroid. That doesn't make very much sense that that's number 4. After that is Ventolin, asthma, different COPD medications, 5.8%. Another one that I put the question marks by, why in the world are we having trouble breathing? Asthma is affecting more young children. So there's something going on, something allergic, something with, I'm going to say, chemical exposures we're probably getting adapted to in our lifestyle. We don't even think much about it, but all the different things around us, the synthetics and carpets, our clothing is all synthetic at this point. So something to think about. Metformin, diabetes, 5.3%. I don't really want to talk too much about this. We know why diabetes is on the rise. I will discuss in another video specifically type 2 diabetes, but kind of a sad state of our health of our society. Number 7, blood pressure, Norvasc, another one, 5%. So when you look at this grouping makes up 1/3 of all medicines prescribed. That's pretty amazing, because what are we working on? You know, infectious disease, heart disease. What do we have? 5 different diseases here that are taking up 1/3 of all the medication. I would think this would be an area that we have to revamp and start looking into. Why are these diseases happening? We're not going to get too far into that. We are going to talk about heart disease though. So number 1, number 3, and number 7 in this chart are all prescribed for heart disease, prevention of heart disease. That makes up 1/5 of all the medications prescribed in the United States. That's a lot of money. That's a lot of pills. So the problem with this is we've actually had increased risk of myocardial infarction. So heart attacks have actually increased during all this time. We've been spending money and people have been taking these pills. Heart attack rates are increasing. And when I was doing a little research on this, it's so deceiving the way the CDC and National Institute of Health and even the American Heart Association describes it. They paint a rosy picture. They keep on saying our mortality rate of heart disease has decreased so much over the years. Well, the mortality rate is decreasing because we're getting way better with surgeries, acute interventions. People recognize the symptoms of a heart attack and they're going to the doctor sooner. So it's not the prevention that's decreasing this. It's not helping at all. We're actually seeing more of these events, especially in the last year. Myocardial infarction in young people is skyrocketing. Sudden death from a heart attack, which isn't as common, is happening more often too. So we're having worse heart attacks than we've ever had before. So mortality is decreasing only because of our interventions with surgical procedures. Amazing how it's kind of hidden from us that we're actually having more heart attacks even though we're taking all these medications to prevent it. So let's do a little talking about what causes heart disease. So I'm going to change over my screen and I'll be right back. So what is the cause of heart disease, heart attacks, myocardial infarctions? So at the root of it, Atherosclerosis is the actual disease process. Atherosclerosis means hardening of the arteries. So if we look at an artery in cross-section, the current theory of conventional medicine is that these arteries are filling up with fat plaques due to the high cholesterol. So increased blood pressure is one of the risk factors. Increased cholesterol is the other that they're addressing in conventional science. Obviously smoking. Smoking is going to increase heart rate, increase your blood pressure. It's going to stress the heart. But hardening of the arteries, so this black line on the inside of that artery that I drew in, what that's symbolizing is calcification. So the true nature of heart disease is not necessarily the lipid buildup within the arteries narrowing the diameter. It's that calcification of the artery. That calcification makes that inner lining of that artery not a smooth surface anymore. It's irregular and jagged. So lipids are going to accumulate on that jagged surface and start to build up. So if your cholesterol is high or low, triglyceride balance is high or low, it's not going to matter. Eventually you're going to build up that area. I had it explained to me when I was learning this from another physician that was giving a lecture on the true nature of heart disease. And it was interesting because he pointed out that if it was lipid buildup within the arteries, we would see this problem occurring more in the periphery within the smaller blood vessels. Instead, the place that we see atherosclerosis happening is in the large high pressure zones of the body. So the carotids, the aorta, and the coronary arteries that feed the muscles of the heart. So it doesn't make a lot of sense that the lipid levels within the blood have anything to do with heart disease. So this theory is written because as they go in and they do a bypass surgery and they pull out that diseased artery that's blocked, they're finding all that fat deposit in there. So they, of course, developed a pharmaceutical saying fat was to blame. Obviously, from the earlier part of this video, we're finding out that's not working. That's heart attacks are on the increase. So the introduction of these statin medications have done nothing for decreasing heart disease. So high blood pressure, the other element, completely makes sense. The reason these arteries are calcifying is because of damage, basically. So just like you would see in orthopedic practice where when a tendon is pulling on a bone and that tendon's constantly repairing itself with collagen fibers, if it can't keep up or it's just a continuous chronic process, it's going to calcify that tendon, creating a spur. Well, the same thing is occurring in blood vessels. As the heart is beating and the constant wear and tear that's occurring there, it's going to eventually get to the point, if it's too excessive, that you're going to calcify these inner linings. So blood pressure is the root of the cause of it. Now, what exactly is a heart attack? A heart attack is when a clot comes along and that narrowed out area gets plugged up. That's occurring, enjoy my heart diagram, in the blood vessels that feed the muscles of the heart. So when one of these guys get blocked up, this section of the heart's not going to get blood flow and we're going to start to get tissue damage and death, which will lead to inability of the heart to completely work like it should. It can still function, but if you get too much tissue damage, it's not going to be as efficient, and that leads to eventually congestive heart failure after multiple ischemic attacks of the heart. So what's the cause of the plaque? As I already said, it's not cholesterol, obviously. That doesn't even make sense. It's damage in the inner lining of the blood vessel. Nutritional deficiencies could come into play. I read an article, it was back in the big Linnaeus Pauling vitamin C guy, that they induced atherosclerosis in mice by feeding them a diet deficient, not absent, but deficient in vitamin C, and it induced atherosclerosis. When they regave them the vitamin C, that atherosclerosis reversed. Is that the common reason that this is occurring? Probably not, but nutritional deficiencies could come into play. Inflammation. That's the big boy. Even the conventional science is starting to switch gears on heart disease and go, this is an inflammatory disorder. So myocardial infarctions are chronic inflammatory in nature. That constant inflammation within the system is overreacting to the different damage that is occurring and overcompensating. So what is causing all this inflammation? Well, diet is huge. Most of these processed fats that we're consuming and all these other food additives are causing inflammation within the body. Excessive stress, that's also going to cause inflammation. You're getting those high cortisol levels, you're in a pro-inflammatory state. So, and as I said a million times, not a million, I've already mentioned that increased blood pressure. So at the root of heart disease, it really does seem to be a blood pressure inflammatory disorder. Nothing to do with the cholesterol. So that's one reason why those medications have not been effective. The other question that we're going to get into is, why is it that the high blood pressure medications haven't made a difference? Well, the reason for that is the blood pressure is not being caused by, the high blood pressure is not being caused by what the medicine is addressing. So hypertensive medications, what they're going to do is, as your blood vessels go from large arteries into medium-sized arteries, and then eventually into the capillaries, the target of hypertensive medication is it relaxes the smooth muscle that's in that blood vessel. So when it relaxes, it's increasing the diameter. The theory being that that's going to decrease the overall resistance to blood flowing within the body. The problem that they're finding with these blood pressure medications is they are effective at neutralizing blood pressure temporarily. The body eventually compensates, because when you're relaxing that, the system has feedback loops in it which tell it that too much blood is going to that area, and you start to compensate and reconstrict. That's why you get into the situation where someone's on one blood pressure medication, then they add a second, then they add a third, then they add a fourth. Well, they're temporarily decreasing that blood pressure is all that's really occurring. New research is saying that the root of high blood pressure, hypertension, is not coming from these large and medium-sized arteries, but at the very end of the line in those very tiny capillaries. Common sense would tell you that was probably the root of the cause. But what's the mechanism behind this? It's not something that a simple medication is gonna help. So when you get into a very small blood vessel right before capillaries, you have red blood cells just kind of conjugating, bouncing around. But in order to get to that capillary and flow through it, they actually have to stack. It's called rouleau formation. So those blood vessels will all organize, blood cells will all organize into this almost like checkers stacking, and they go through that blood vessel all in this direction. Well, research is showing that hypertensive people, they're having an increased viscosity and increased resistance within these capillaries, because these blood vessels are no longer perfectly shaped with that biconcave structure. Hypertensive people have very large blood vessels, irregularly shaped blood vessels. So when these things are lining up to go into the rouleau formation, they're creating a resistance in these smaller arteries. What's causing this? Well, multiple factors. We go back to the nutritional deficiencies, we go back to toxicity, but one of the interesting things I ran into during my research writing my book was that radio frequencies have a negative effect on red blood cells shape. So being exposed to these EMF fields are actually going to create irregular shaped blood vessels. The other interesting part is red light therapy studies have shown that when someone goes under red light therapy, their blood vessels will all become uniform. They'll all become biconcave and their size will shrink down. Well, that makes tons of sense if you're thinking about it, because blood vessels, these red blood cells are coming to the surface of your skin. When they're at the surface of their skin, they're actually absorbing that electromagnetic energy, and that's what's creating the ability of these guys to produce their own energy. Red blood cells do not have mitochondria. They do not have a nucleus either within them with DNA. They're kind of like wild, how should I say, oxygen-carrying, energy-producing machines, meaning they're self-sustaining on a very, how should I say, volatile way of producing energy, ATP. They're doing it as they transit the skin. Those hemoglobin molecules are just like those cytochromes I talked about in the mitochondria. They're binding oxygen, creating those reactive oxygen species. If these reactive oxygen species levels get out of hand, like I talked about in the mitochondria, the blood vessel will get damaged. So, pretty simple. So, what's the solution to this? Well, obviously, cleaning up the diet. You want to eat a healthy diet, which is going to strike down another aspect of hypertension is obesity. If you're carrying too much weight, obviously that's going to create more resistance because there's more body mass and more capillaries. So losing weight, getting exercise, being in the sun during it. You don't need a red light therapy booth. Mother Nature is creating all the energy it needs. If you're getting sunlight on your skin, you're going to make your red blood cells healthier. So nothing all that complicated. Anti-inflammatory diet, probably the first step I'd go to when it comes to nutritional modification. Mediterranean diet, something that's going to just bring your overall level of inflammation down in your body. It's quite remarkable. A lot of people don't really comprehend the fact that when you make a change from an inflammatory diet, regular Western diet, to an anti-inflammatory diet, you lose a lot of weight in the beginning, that water weight that people find when they lose weight. You're not losing water, you're actually decreasing the inflammation within your system. You're not as swollen. So the last part of this, the final thing I have to recommend with blood pressure and heart disease, it's stress. When I was doing a little research on this before I gave this talk, I couldn't get over how many things were popping up about excessive work hours, working overtime leads to hypertension, and it kind of made sense. If you're working all those hours, you're probably doing it because you're stressed about money. It just compiles on itself. So a healthy lifestyle of good diet, sunlight, and dealing with stress, not overworking, keeping yourself so that you're, I should say, happy. You're not constantly at work just trying to fight your bills. Live a lifestyle that's just balanced. So hopefully that makes a little sense. If you're on medications currently and you are thinking about getting off them, obviously you want to discuss it with your doctor. If your doctor is non-compliant with you about changing the lifestyle and getting off your medicines, time to find a new doctor. There's plenty of alternative medical doctors out there that are willing to work with you. Just don't go chasing down supplements as the answer. I'm sure there is some herbs out there and different remedies of sort, homeopathic, that will help with hypertension. But again, is it addressing the problems? Is it addressing that your lifestyle is not conducive to health? So hopefully this all makes sense. If you got questions, I love talking about this topic. I was blown away when I had first learned about this whole cholesterol myth. It blows my mind. And if you think about earlier in the video, #1 prescribed medication right now, and it's doing absolutely nothing to prevent heart disease, but it is causing a lot of side effects, muscle aches and pains, even liver damage. So quite the topic. So hopefully you enjoyed it. Thank you.